Nice. Good evening, everyone. Welcome to another Medical Mondays with Dr. O, where we share information, where we learn more in bettering our health. I am Dr. Toyin Okwesome, a family practitioner, HIV specialist, and I treat addictions in Maryland. Tonight, we have one of our very, very own, Dr. Ajibade, coming to share with us some important information about how to guard our health, starting with our brains, our heart, and, all organs of the system. So, welcome to Medical Mondays with Dr. O. And Dr. Ajibade, the floor is yours.
Okay. All right. Thank you, Dr. O. Thank you for inviting me. Good evening, everyone. It's great to be here. We're going to be talking about the 3 things that every Black person must know, not just Black person in the US, whether in Nigeria, Australia, wherever. I'm going to start sharing slides in a minute, but let me just go ahead and do that so that we can get right into it. Okay, just let me know if you can see my screen. Everybody can see my screen yet? Yes? Yes? No?
Yes.
Yes. Okay, great. Okay, yes. Thank you very much. All right, let me just see if I can minimize this. Yes, minimize this. Okay, great. Okay, so what we're talking about today are the 3 things that every Black person must know. And I was speaking with Dr. O, and I was like, these things just keep on coming up. As you know, probably many of you know, I volunteer with the Alzheimer's Association, and they've just been, this month I'm going to be very busy, and next month, just talking to different groups about dementia. And I'm focusing a lot on Black people because obviously some of the statistics say that we're twice as likely to have Alzheimer's disease as white people are. And some people say that, oh, that's just it's all propaganda, and this is not true. But I tend to want to agree with it because it's not just where it comes to dementia. We also look at things like diabetes. Diabetes, again, we're twice as likely. Certain forms of cancer, we are many times more likely to have. And the question in my mind has always been like, why is this so? And why isn't it being talked about more so that we can find out what is going on and what we can do about it? Because in the final analysis, it's really about knowledge and how we can take control of our health. But if we don't have the knowledge, if everything is about racism and everything is about what they call institutional racism or racial disparities, which are absolutely true. There are lots of studies about it, but they can't be the only things, because even in Africa, Nigeria, where we're all Black, these issues still arise. Now, we're a younger country. Our lifespan is still appallingly low, 54 years, as opposed to 70 something in the US. But still, we still see these conditions begin to arise, and they're rising even faster in these days, in this modern world in which we're living in. So it can't be, again, I want to say this, when people are talking about, it's the reason why we have dementia is so much worse is because of racism. I agree to a certain point, but I also say that it can't be the only reason. Again, like I said before, and the problem with that answer or with that response is that it takes away the responsibility and the empowerment from the individual. If the individual gets cancer, or the individual gets diabetes, or the individual gets dementia, and all he's heard is that it's because of all the stress, all the injustice, all the problems that have risen over the centuries, and that's why this person has so and so. He tends or she tends not to be aggressive about regaining their health. But if you know that, well, there are other factors too, like biological factors or genetic factors, or lifestyle factors or dietary factors, things that they were doing or they were not doing that led them to this path. It helps, one, it helps you prevent a condition, and two, it helps you recover because you now know what to do in addition to what your doctor is doing for you. So with that said, let me get into, with that monologue, let me get into the rest of the talk. So these are the three things. I'm just going to go right into it, let you know, and then we shall discuss them as we go further. One, our bodies are different. That's just the basic thing. You can't get away from it. We handle certain drugs differently. I'm going to talk about some of them. We handle certain toxins differently. We handle certain foods differently. And again, like I said, I'll talk about it soon. Number two is that we are relatively deficient in certain nutrients. These nutrients, I've talked about them in other talks, maybe when we talked about the brain and Alzheimer's, dementia, and cancer. We're deficient in certain things that help the brain work. And again, I'll get into some of that. And then number three, many of these medical conditions that we talk about, that we hear about, heart conditions, brain conditions, strokes, even lung conditions, even things like asthma, we tend to be diagnosed at an earlier age. We tend to have it worse, and the treatment is less successful. One of the reasons why this is also is because research has been done mainly on the white man, not just the white person, but the white man. And I say this, and I make that differentiation because even white women, I listened to a cardiologist, a white cardiologist, saying all the tests that they were doing were on white men. And now we're finding out that a woman's pattern of heart attack and heart disease is different from a man's pattern of heart attack and heart disease. But most of the research has been focused on the man's pattern of heart disease and assuming that whatever obtains in the man obtains in the woman. We now know that that's absolute folly. And so the women are beginning to shout now that, listen, excluding we women, and that this is how our heart disease works. Well, Black women are still different from white women. So there's still a difference where that is concerned. Unfortunately, because of all the injustices and the things of the past, you don't have as many Black people volunteering or getting involved in these research studies, which is unfortunate, because if we could find more Black women and Black men being involved in the research studies, we'll be able to understand how different diseases happen in them and to be able to fashion and develop drugs that will specifically target our conditions. But as it is now, that is not what obtains. So we have to learn, and I'm going to come to the solution, what I feel is the solution to this. We have to, one, be knowledgeable. We just have to be knowledgeable. We can't afford to be ignorant about certain things, especially in this day and age when these diseases are getting worse and worse and worse and worse. And of course, the hospitals are getting more crowded, as you know. All right, so let's have a few examples. So when I was studying on dementia, one of the things that kept on coming up were toxins. Now, we don't talk about toxins much when it comes to dementia. We're always talking about these other things. But toxins, whether toxins you put on your food, in your hair, your skincare, drinks that you take in, they are finding out, and I think I'm going to mix. I'm just going to go to smoking right away, because smoking is a very good example I have. Smoking is obviously a toxin, the smoke that you inhale, and I'm hoping that most people have stopped smoking. Please don't smoke. That's what they shout about that all the time. That's the best, one of the best wins you can have is to stop smoking. Amongst other things, smoking, it constricts your blood vessels. It stops blood from flowing to the brain like it should, to the heart, and so on and so forth. But more than that, what we are finding out when it comes to lung cancer is that Black people tend to start smoking at a later age. They don't smoke as much as white people do in the earlier years, but they start smoking at a later age, and then they smoke for a shorter period. They don't smoke as much in general of cigarettes. Now we're talking about cigarettes. They tend to be more apt to stop smoking it doesn't matter. What they are finding out is that even for that shorter period of time that Black people are exposed to smoke, they have much higher rates of lung cancer. In other words, the toxins had a greater effect or have a greater effect on us. Same thing with women. They're saying, okay, all this makeup, all this skin care, all this personal care, we tend, or when I say we, I guess Black people, but women in particular, tend not to be able to metabolize as well. And I have my reason, and I have my thoughts about that. I think so. Again, like I said, we'll get into some of that, but there are the issues there. Another thing is with the drugs. I'm going to use cardiovascular drugs as an example. If you're a white doctor and a Black person comes to you and you find out that he's hypertensive and you don't know, the white doctor does not know that the drugs that you use that work for you are different from the drugs that the white person uses. That person may end up hurting you. What we now know is that certain drugs work best for Black people. Calcium channel blockers, amlodipine, many of you probably know about it. Amlodipine and then thiazide diuretics, those are the two. Those two don't work for white people. So there's a difference in our biochemistry. And then finally, coagulation. And these are just a few examples. We tend to have higher tendency to form blood clots than white people do. And that's why if they're trying to give you blood thinners, in general, they tend to give higher doses to Black people because they have seen that blood clotting is higher, and that's why if a person has had a stroke, they have to give higher doses of blood thinners, anti-clotting factors, so that it will prevent further strokes in the person. Same thing with heart attacks. So I have in front of you a picture of the major diseases. I remember I said that some of these conditions they tend to be more severe and they start at an earlier age. These are the examples I have: heart disease, lung cancer, colon cancer. Now they're saying that you have to start screening for Black people earlier than white people because it seems to start earlier and it's more aggressive. 45 years of age is now the accepted time or age for Black people to start screening, to start being screened. They're saying something similar about breast cancer as well. As you know, all over the world, not just in the US, all over the world, prostate cancer, breast cancer, Black people, we reign supreme. And then asthma too is very, 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 very prevalent among the younger kids, especially those who live in the cities and where air pollution is rampant, by the highways where air pollution is rampant. They tend to see it worse among Black kids. So let's talk about the deficiencies. You probably heard me talk about this before if you've been on these shows. These are the ones that stand out the most. They stand out the most. And so what we're trying to do, I'm talking to Dr. O about it too, is that, well, there's no supplement on the market or no nutrients on the market. And I know I'm skipping a little bit now, but there's no nutrient on the market that has the right doses with the right kinds of combinations that is specifically targeted to the Black person. And I'm like, that's a mistake. Why isn't somebody doing it? So I'm really seriously to think about putting these all together in the amounts and the doses that are necessary, just to give Black people a basic formulation that covers all the bases, rather than giving them. I have like 10 bottles on my table. I have like 20 on my shelf, and I'm always taking every single day. I'm trying to, because I know I would be a fool not to be taking these things, because I know what not having them does to my body, anybody's body. And it seems to us that some of these foods these nutrients we're missing, we're deficient in them. So just from the top now, the first one I guess is vitamin D. You've heard me speak about it ad nauseum. It's not just a vitamin. This is something that regulates even down to the DNA. It regulates the expression of your DNA. It affects your immune system. It affects your brain. It affects your cardiovascular system. It affects your muscles. It affects your energy levels. One of the things that I was really surprised about when I was back in Nigeria, Once I started learning about vitamin D, I started shouting from the rooftops, people, you have to take vitamin D, you have to take vitamin D. And I started dashing them out. And the people that were taking, even the men, one of the things that kept on coming back to me was that the men would come back and they would say that they would wake up in the morning and they don't have the stiffness in their back, the stiffness in the joints that they used to have. I didn't even know vitamin D affects joints and muscles, but it does. We all know it affects the bones, but the joints and the muscles, it affects that as well. Obviously, it affects the immune system, and there are studies now coming out about how the immune system in COVID-19, how important vitamin D3 levels were in the whole pandemic thing. They're now coming out with hard data. Obviously, I've been screaming about it before, during, and after the pandemic. I've been screaming about vitamin D. Now the data is available. Same thing with Alzheimer's disease. They're now seeing that 40% of that just having enough vitamin D can prevent Alzheimer's disease in 40% of cases. Now, obviously, you're not going to be hearing this on the TV because vitamin D is cheap. What else can I say? Magnesium is very important for everything, for the brain and the cardiovascular system as well. Vitamin C, super important for the brain and the cardiovascular system. So I'm just going to, I've talked about these before, but these seven, the big seven, or the non-negotiables, like I say, they seem to be the ones that pop up all the time. And here's the thing. If you are not getting it in your food, and you know that you're not getting it in your food, and I just don't understand it when doctors start arguing and people who are supposed to know better, they start, and I get this all the time because I speak in groups and in live meetings, and they start arguing, oh, that's just get a balanced diet. I mean, who knows what a balanced diet really is? I mean, right now, even the food that you get, whether you eat clean food or whatever you may think about it, even the soil, we now know that the soil does not have the same amount of nutrients that the plant needs as it did 20, 50 years ago. So, even if you have an absolutely perfect balanced diet, you are not getting the same thing you were getting before. By the way, if you're Black and you're not out in the sun, chest exposed or body exposed to the sun, you're not getting enough vitamin D. You're not getting it from food. So when people start arguing about it, I really don't understand it. I mean, bottom line is that you've got to focus on the basics. We don't have, the medical system is not geared towards the Black person. Let's just fake it. Let's just face it. Make the most of it. Have your insurance. Make sure you do your yearly checkups. Another thing, you want to make sure that your dental health is optimal, because we now know that your dentition and your gums the health of your dentition and your gums can affect your brain and your body and your cardiovascular system, especially. So you want to make sure that those basic things are taken care of. You want to make sure that you take your drugs, your medications, especially the ones that have to do with blood pressure and blood sugar. We're especially at risk of those things. And we now know that high blood pressure over a long period of time, high blood sugar over a long period of time, eventually can cause, amongst other things, dementia. As you know, there's no treatment for dementia from the medical perspective. Now, obviously, we've been doing this in Nigeria. We've gotten permission from the federal government to treat and address conditions that are dementia-related, memory-related, and we've been very successful at it. But that is because we have the license and the ability to do it in Nigeria. We also do telemedicine where we consult and we share, but not in the capacity of someone who is licensed in the US. So that's just the difference I want to bring up. Here in front of you here is what I talk about a lot, which I call the laws of life. And there are 7 of them. These are the basics. These are the things that affect human life. Anything that you're involved in, whether it's marriage or business or schooling, or you're about to embark on whatever it is. These are the 7 things that affect the health of your life. Now, depending on what field you're involved in, some of them may be more important, but you can't get away from the fact that the words that you speak about yourself and about others can affect your brain and your body. Same thing with your beliefs, There's no time to go through all of these. So I'm just going to hijack some of them and just talk about them a little bit. Your relationships, there's a Harvard study that says that the people who live the longest and lived the healthiest, 80 and above, are those who had good relationships, who had meaningful, lifelong relationships. So relationships are very important. If you can't get a supplement that has all of these in the right amounts, I strongly suggest, as a Black person, you want to take, there are about 3 or 4 that you absolutely should take. You should take vitamin D, vitamin C, potassium, magnesium, D, vitamin C, potassium, and of course, vitamin C. The B vitamins are, I mean, you just make sure you take vitamin D, please. I think vitamin D is super important. I'm just going to round up with this because I see our time is gone. We have about 12 systems in our bodies, right? You've got the cardiovascular system, you've got the nervous system, skeletal system, endocrine system, and so on and so forth. There are 3 systems that I have seen that are probably the most important for you to pay attention to, especially if you're a Black person. There are 3. Of the 12, there are 3, and these are the 3. You want to take care of your cardiovascular system. In other words, you want to make sure that your blood pressure and your blood sugars are normal. In other words, you must take your drugs as prescribed. And if there's going to be any change, make sure you check with your doctor about it first. In addition to that, obviously, you want to take vitamin D, vitamin C. I feel like I sound like a broken record now, but vitamin C, vitamin D, and zinc, and obviously vitamin K. Those things help to maintain the health of the walls, the inner walls, the smooth muscle walls of the blood vessels. The most important thing you want to take care of are the arteries, because those are the ones that carry the blood, that carry oxygen to your brain and to the other tissues. So you want to ensure that you are providing your arteries with the nutrients they need to function well. If you don't, they're going to get diseased, they're going to get damaged, they're going to start getting tighter and less pliable, because you want the blood to be able to flow and the blood vessels relax. If the blood vessel is flowing through and the vessels are tight, it's a problem. The number 2 is the immune system. But I tend to say, and the immune system, obviously, because cancer is a big problem among we Blacks. But think about it, 70 to 80% of your immune system is in where? Your digestive system. So I tend to say, let's focus more on your digestive system, because if you focus on your digestive system, your 80% of your immune, 70 to 80% of your immune system is there. So you have to know what to eat to take care of your digestive system. You want to know what supplements to take to ensure that your digestive system is healthy. You have to know what not to eat. And here's a hint: you want to take fiber, lots of fiber. I take the powder, because I can't trust myself to be taking a salad 3 or 4 times a day. I mean, who even does that? The standard is 5 to 9 servings of fruits and vegetables a day just to get the fiber you need. Who does that? Anybody who does that, there might be some problem there somewhere. I don't know. But anyway, yeah, so there are things that you have to do to take care of these systems. And so people are surprised when I put the brain and the nervous system as the last of the 3, because obviously you think that the brain is the most important organ in the body, so you need to pay attention to the brain first. But I'm telling you, if your blood flow to your brain is faulty, forget how healthy your brain is. It's gone. It's a goner. So you want. So I found out, even for dementia now, they are saying over 80% of all dementia cases have a cardiovascular problem. In other words, they have the problems with their blood vessels. I think that's a conservative number. I think over 90% will have a cardiovascular problems with the arteries that go to the brain and within the different regions of the brain. I'm pretty sure that is the case. So if you are going to take care of your brain, you've got to ensure that your your cardiovascular system is as optimal as possible. You got to ensure that your immune system is working too, because we're now finding out that even immune function is critical to normal brain function. So you want to take care of your your immune system, and therefore you want to take care of your digestive system as well. So those are the big three that I really, really feel you need to take care of. Again, these are the laws of life. I think of everything that you can apply, I think the easiest, because we're always putting something in our mouths. So the easiest is to put something in our mouths that put the specific nutrients that your body needs. I was speaking with a doctor who has a big hospital in Nigeria, a massive hospital, and she we're talking to her. She was dealing with the problems of menopause, hot flashes, and everything, and memory problems, mood problems. Her blood pressure is out of whack, and I was basically explaining to her that, well, this is what's going on. This is what's going on, and you might need to take vitamin K because she and her mom have bone issues. And I was just explaining all these things to her. And this is someone who has all the wealth and all the access to super medical professionals, and nobody had told her these things. Because even your endocrine system, by the time it gets to menopausal issues, and I know I'm talking about, this is a little bit out of the scope of what we're talking about now, but I feel that some people who have menopausal issues would like to hear this. Once menopause begins to happen, and what is happening is that your hormones are now beginning to get out of balance. There's a drop in estrogen, there's a drop in progesterone, but the drop is worse with progesterone, and everything is out of whack. There are now nutrients and supplements that we use for our patients that can help to provide the building blocks for your body to make the sex hormones, estrogen, progesterone, testosterone, in the right balance. So it's not like you're given HRT. You're not given the finished product of estrogen and progesterone. You're given it in food form, so the body decides how much to make at what point in time. That is much better because we now know that there are major side effects to just giving those hormones. So there's something that can be done in that regard as well. The reason I'm bringing that up is that in the menopausal periods, blood pressure too tends to go out of whack. It's not as well controlled and regulated as it used to be when you were in your 30s and 40s. So that's another thing to think of. You've got to do whatever it takes. Of course, you want to sleep. Make sure your sleep is optimal, dark room, and we've talked about that before. But those will affect your blood pressure for sure. The other thing is that you want to make sure that you take your basic supplements. I know I've said that before. So because of all these things going on, I keep on saying that just having once in a while, just coming on to Dr. O's talk and talking about this is not enough, in my opinion. So we're going to be working on providing courses, actually doing like 6-week courses on some of these issues, so we can really go deep down into it and really address these problems, answer your questions, provide you with other resources so that you can be properly equipped to really understand how these things are. And obviously, you can share it with your friends and family too, so that you can take control. But the thing I want to leave you with is that you can't. You've got to take added extra efforts. They say this before. I don't know if it still obtains, but if you're a Black person to succeed in this world, you have to do twice as much as a white person, or do 4 times as much as a white person. Well, at the same time, when it comes to your health, we tend to be extra careless when it comes to our health. Now we have to, buckle up, tighten our belts, and learn about what these things take, because the threats to our health are only getting worse. The threats that are outside in our foods that we unknowingly just take into our bodies, put on our skin and our hair. The big companies that are producing these things aren't really concerned about your health. They are concerned about making a profit. And it's like a race to the bottom. They're trying to make it as cheap as possible. Health be damned. They just want it to be as cheap and available and as scalable as possible. And they are, and as you know, they have lobbyists everywhere. So they are pushing on Congress and everybody to let them pass these things through. So you are on your own, is what I'm trying to say. You are on your own. So you have, and there are things, thankfully, we live in a day and age where there are things that are available that can help protect your brain, protect your body, enhance and strengthen the systems in your body, especially your cardiovascular system, your digestive system, and your brain. And we can make those, we can always be happy to point you in the right direction. So with that, Dr. Ho, thank you so much. I'll hand this back to you.
Thank you very, very much. Wow. That was loaded, straight to the point. Awesome. I have questions. You know, if you have any questions, you can raise your hand to ask it. That's the simplest, easiest way to do it because you get your voice heard right away. Or you can put it in the chat box and I'll be glad to help you to read it out. So you said a lot of things. You know, your second to the last slide, which you showed, I think, twice or so, or 3 times, you said in there that what you say, what I think is something about what you speak, how you speak, you know, what you say is important.
Yes.
I think, you know, when we look at our people, and I'm talking about Black people generally, it doesn't matter where your Black comes from, we tend to take that first statement very, very seriously. Because I've seen patients in clinic that have, for instance, high blood pressure, or they have diabetes, or any disease entity. And when I let them know that they have this, we need to intervene, they will say things like, it's not my lot in Jesus' name. God forbid. Not me, and stuff like that. You know, the lack of acceptance to start off with is a problem. The lack of acceptance of, you know, the fact that there is a problem, we need to fix it. If people don't accept it, then how do you intervene? Or they will not be compliant. So that first statement you wrote, I want more clarification because on that, what did you mean?
Well, so that first law, yes, everything. I mean, so it's the words you hear, the words you read, the words you speak. So, but most importantly, obviously, is the words you speak, especially if you're an adult. If you're a child, it's mostly the words that your authority figures in your life speak, because they can shape your beliefs, shape your actions, and for the rest of your life. But yeah, I mean, so, and I guess in church settings, do you want me to address the one that's what you said about how what patients say when you tell them, give them bad news? Is that what you specifically want me to address, or you want me to address?
I won't, yes, no. I was asking in terms of the fact that telling somebody they have hypertension, diabetes, or whatever disease entity is not necessarily bad news. If the person comes in, they have hypertension and it is caught and we control it, then they would not have a heart attack, stroke, congestive heart failure, kidney failure, or blindness, which are possible complications of untreated or poorly treated high blood pressure. And so if it is caught on time, the diagnosis is made, treatment is instituted, and the blood pressure is controlled, then they don't have any of these complications. They don't get any of those things. So it is not bad news. I'm saying that, you know, in our culture, Black culture generally, if, you know, something is diagnosed, people don't want to accept it and they will reject it. It is not my lot in Jesus' name, because they feel that what you say becomes problematic if it's negative, and they see that diagnosis as negative. So when you wrote that when what you hear, what you say, you know, I'm thinking, oh my gosh. And at the same time, you're challenging us to pay attention to our health and to do the needful and, you know, prevent dementia in this case. I'm thinking, can you explain that further, that it does not mean you don't accept diagnosis, right?
Oh, definitely doesn't mean that. I think what I was trying, without taking too much time, is that we have to learn how to say words or speak words in line with health and strength. I mean, a person is saying it's not my portion when they have already factually diagnosed hypertension. I guess there's nothing else they can think of to say, and that's what they've been trained to say. But what would be better for them to say is, okay, well, that's what the medical science has said. As they can start confessing scriptures that are in line with a healing, and they can start doing that over a period of time. Clearly, they were not doing that before. It's not going to work if you never said positive things about your health and saying that I'm healed, and saying the healing words and the things that are in line with what you believe to be true from a scriptural point of view. If you were not saying those things before, and then the doctor now says you have hypertension, just saying it's not my portion there and then is not going to solve the problem. It's when you walk away, you now have to start doing what you should have been doing before. You now have to speak the words in line with your healing. But it's beyond all that as well. Many people say things, they don't realize the connection with their health. There are people who have jokingly said, oh, I'm not going to live past 40. By the way, Martin Luther King said that over and over again. He secondly said he was not live past 40. And guess what happens? Am I saying that that's what caused his death? No, but it could have contributed to the events and the circumstances that had it. And I can give you story after story after story of other people who have said similar things, and it ended up happening. We know as surgeons know that if a patient starts saying, whether jokingly or not jokingly, that if you operate on me, doctor, I feel I might die. They know a smart surgeon will stop that surgery and reschedule it until the patient is saying the right things, because some of them have learned that the words that patients speak can affect their recovery. So and like I said, there's a whole thing to it, but you have to learn how to use words wisely. And again, to Dr. O's point, I'm just not sure somebody's saying that's not my portion at that point in time. I'm just not sure that is effective. I mean, you can irritate the doctor for sure. But
no. Thank you so much. I have hands raised, and I don't want to. Thank you for addressing that for me. Ms. Temi Taylor, kindly unmute, and we have some questions in the chat box that I will refer to in a minute.
Yeah, good evening, Dr.
Good day.
Good evening.
Welcome.
Thank you, ma'am. So I have two questions. You mentioned medical research, Black people. So are Black people actually properly informed about any kind of medical research in place, or they are intentionally not informed to carry out medical research on them? And if they were actually informed, where and how can they get this, information? Because I'm sure there are a lot of people out there who will be willing to, but how do they get that information? So that's number one. And number two is vitamin D. You really lay emphasis on vitamin D. Are there any side effects or too much taking of vitamin D? Are there any side effects, or how can you, I know you can talk to your doctor about it, but I just want to know your opinion. Thank you.
All right, thank you for the question. Dr. O, the one about the informed consent and the access.
I'll answer it.
Okay.
Do you want to take any of them, or should I answer them?
No, I can take the vitamin D one.
Go ahead.
Okay, so with the vitamin D one, side effects are really minimal. Now they are saying, I mean, the doctors who now know are saying that the minimum is 100, and the measurement is 100 millimoles per DL. That's what they should have. Before now, they said if you are deficient, it's below 20. If you are insufficient, it's below 30. And basically, what we're finding out is that those levels are just to keep you from having disease. But if you want to have optimal levels, they are now saying it's about 100. I take like 10 to 20,000 a day. I'm not saying that's what you should take. Certainly not, because I'm overweight. I know I don't look it, but technically I'm even, well, last time they checked me with the BMI and all that, I was obese. So so I think that thing is racist, Dr. O. That's because I don't think I am. But if you're overweight, if you are over 40, if you have a lot of fat in your body, if you have any kind of sickness, any kind of chronic disease, you need more than the basic minimum. And so, yeah, so to answer your question, the side effects are extremely rare. In fact, the Mayo Clinic said you could be taking, the Mayo Clinic says 60,000 international units a day. I'm not suggesting that. For months is what they found out causes toxicity. I would say if you are very, very conscious, this is summertime, my recommendation is 5,000 international units during the summer, 10,000 international units during the winter, because you know you're not getting enough vitamin D. I hope that's, and then of course you can talk to your doctor, but your doctor doesn't know anything about this, quite frankly. Most doctors, I would say 90% of doctors doesn't know anything about it. They don't know anything about it, which is unfortunate.
You're so unfair. But those are two excellent questions. Vitamin D, I prescribe a lot. Being in the US, it's a blessing because we have the opportunity to actually test. I test my patients like every 3 months to see what their level is. The reason I test is because vitamin D is one of the vitamins that are, fat soluble and can cause toxicity. So what are those vitamins? A, D, E, and K are the, vitamins that can cause toxicity. The rest of them are water soluble, and, you urinate them out, so to say. So I'm very particular about monitoring vitamin D in patients that are taking it. And I have had a few patients who I have to tell to stop, monitor them again, repeat their test in 3 months to decide if I want them to continue or not. And who are these? It's interesting to note that these were all Black men. Levels in the US that are normal range from 30 to 100. And each of their levels were over 100 when I told them, stop, let's see how you do in 3 months. And then, we'll reevaluate to see if you should continue at, 1,000, 2,000, or 5,000. I do not prescribe 100. I don't. I prescribe 1,000 international units. You have to look at the units too, because there are two types of units for vitamin D. I prescribe 1,000 international units if I feel like somebody has a comfortable dose, but I want them I want them to continue taking it so that the level does not go down. Because once you stop taking vitamin D, then your level will go down. So you need 2,000, I'll give 5,000 if they are really deficient, like in the 14s, 10, 6 or stuff like that. And I don't think it's really fair to say that, a lot of doctors don't have a vitamin D. There has been lots of researches done on vitamin D by Mayo Clinic, like you said, Dr. Ajibade, and also Johns Hopkins and some other ones. And researches are still going on. Vitamin D deficiency has been found to cause high blood pressure, osteoporosis, which is a bone disease that makes the bone brittle, that people can have fractures without, through trauma. They just fracture because they have the disease called osteoporosis. It can also cause multiple sclerosis, low back pain. So Dr. Ajibade, when you were talking about men saying that, oh my gosh, their backs are not hurting when they wake up in the morning anymore, that's why, when they replace the deficient vitamin D. It can also cause constipation. It's been linked to dementia, depression, and even colon cancer. So vitamin D is very important to replace. And again, in the US, we are blessed because we can monitor the levels. I've seen it's rare really to have side effects with vitamin D, but I've seen patients who have headaches, with vitamin D, we adjust the level and are able to, get rid of the headache and manage it. So it is very well tolerable. Your first question on research, do Black people know about these things that we're talking about, research and all? Yes, Black people do know, but once bitten, twice shy. I don't know if you've heard about the Tuskegee research, where Black people were taken and infected with syphilis. And then they watched them, didn't treat them over 20 plus years. They went through the first phase of syphilis, the second phase, and the third phase. Neurosyphilis is devastating. I mean, it's incredible. It's devastating. You just destroy the person's life, basically. And this was what happened to Black people. So Black people are not trusting of research anymore since then. We are changing the narrative. We are changing the scene. We are, because we now have more Black doctors, and Black people tend to trust Black doctors. And so we encourage our patients to participate in researches that are civil. We look at the research, we know that, okay, this is okay. This is not something that should harm, any research can harm, because remember, it is testing to see how something would act or react. So more Black people are participating in research, because that's the problem we have. Most of the researches that were done before, were done with white males. And white males don't have the same genetic makeup as white females, Black females, or Black males. We now have found that out in medicine. Dr. Ajibade mentioned something about the blood pressure medication. Is this true that in recent times, when Black people actually enrolled in research, it was found that Black people do better with a class of drugs called calcium channel blockers, or another class called the diuretics. One of those he mentioned in the calcium channel blocker group, he mentioned amlodipine and, the water pills. It was because of research that is developed. So we're working on it. There's still a lot of work to be done. So in your circle, encourage our people to participate in research, because that's the best way for us to know what works for us and what doesn't. Excellent question. So Mr. Chris Otaigbe, please unmute and ask your question. Welcome again from Nigeria, all the way from Nigeria. Of the night. Thank you.
Thank you very much. Thank you very much, Doctor. Oh, it's always a pleasure and a privilege to be here. I must say, first of all, Dr. Ajibade, you have learned a great deal tonight, but you will permit me to be a bit negritudinal at this point. Furthermore, before then, you look familiar. I don't know where you are, but you look familiar.
It's on radio. It's on, I think it's TV. Dr. Ajibade, can you tell us all over Africa, Nigeria?
You have a TV program in Abuja or in NT or something?
Yeah. Yes, I do. Yes.
Exactly. Yes. I think you're either part of Great Nigerian's House, or somebody who is part of Great Nigerian's House, because there was a time we came to Abuja and I met you and you told me this, if you remember.
Yes, absolutely. It was Benga.
Benga, yes. Adimula.
Yes.
Benga
Adimula, yes. Oh,
so,
fantastic.
It's also in media, so that's why.
Yeah.
Yes, I'm in media too. Yeah, we show is every Wednesday all over Africa. Yeah.
Good to see you again, man. Good to see you again.
Good to see you again.
Yeah. The thing is, the first thing is this. Back then, before the white people came into our lives, our forefathers were very strong. and they did things. They could walk miles, they could do things, and of course, that was why they were taken to plantations, in foreign countries to become slaves and all that. They had power, they had things, they could do things even the white men could not do. But today that has, you and I cannot walk miles, and all of that. Here you are complaining about obesity. I don't think that you are fat. But yeah, that's what the moment I'm talking now. But our forefathers were much stronger. You understand? And you wonder because they didn't have any pharmaceutical thing they had to manage, or they didn't go to hospital and all that, but they were doing well. But so maybe you'll explain that at some point. Then the other one that I have to talk about, I have to bring to your attention is it true, because people say that emotional management, emotional response to news of disease or information about disease seems to affect, the level. I mean, the level that disease takes up that person. In other words, for instance, somebody is hale and hearty, and he tells his family, "I'm going for a doctor's appointment." He's okay. He's full of life, and then he gets to the hospital and is in front of the doctor, and the doctor tells him, "Gentleman, you have this life-threatening disease, maybe HIV, maybe BP, maybe this thing." And then the guy freaks out, and then from there on the disease, So I want to learn from you, is that true? Because a friend of mine really experienced that, because he said before he went to the hospital, he was okay. He was even jumping around and all of that. But when he got to the hospital and the doctor told him he had a cancer of the salt, that was the end of his life. Now, from then on, his health carried. So is it true that happens? Thank you.
Thank you very much for that question, please. Thank you. Yeah. So the two questions. The first one, it's a puzzle to me. I agree with you that in the past, our forefathers used to be much stronger and they could walk for miles. So it's almost like a paradox, really. In some cases, I mean, what we see is that the lifespan is still very low for most of Africa, and it has been that way for a long time. 70% of the population is still below the age of 30, not just in Nigeria, but all over Africa. So that's still the reality. But yes, there are those who manage to survive. I don't think it was a routine thing in Nigeria or other parts of Africa that people were routinely living to their 80s and above. I don't think in any period of time. Now we know Dr. O's, we have many examples everywhere of people whose parents, Dr. O's mother, 93 or 94 recently, Dr. O.
94.
94.
And my father was 90. My aunt was 106.
106. So God bless their souls. But I just don't see it as being a common thing that people routinely living to 80 and above. It seems to me that more often than not, it's the opposite is the case. And that's again because of all the tropical diseases and the illnesses and all those things that, in a way, modern medicine has helped prolong the life. I mean, if you were to mention one thing that has helped prolong lives, obviously other than vaccines and good water, it's modern medicine. Now, as to whether the quality of life is the same, whether they are strong enough to walk hundreds and hundreds of miles, that's a different story altogether. But we know that people are living longer primarily because of access to modern medicine. Now, having said that, again, is the quality of health is a different matter entirely. To the other question, and if Dr. O has something else to say, I'll just wrap up. To the other question, there's a lot to be said about your mental states and the state of your spiritual state. And I believe that we are spirit, soul, and body. And that's that spiritual aspect of who we are, that essence of who we are. It says a lot about your overall mental and physical health. That's the life force, that's the energy source of your body. And what we know is that a lot of people have built in this deep-seated fear over their lifetimes of these chronic or these life-threatening diseases, cancer, heart disease, and now, of course, Alzheimer's disease. Everybody is scared of Alzheimer's disease. So once the doctor, you've probably heard of white coat syndrome, which means that once you go into the presence of the doctor, you may have normal blood pressure before you come to the doctor. You're all scared and there's white everywhere. The nurses are walking around with injections. You tend to have a higher blood pressure. People tend to have a negative reaction that is higher when it has to do with a diagnosis, especially if the doctor just delivers the message in a nonchalant way. There should be a better bedside manner, but that's a different thing. I treated cancer patients for many, many years. So so we saw what you're describing now, we saw it. The person comes in, oh, my stomach is paining me, we've done this test, we've done that test, nothing happened. When they finally come to us, the oncologist's department, and we do the test and we finally find out it's cancer. That very day, that person's life their health begins to deteriorate and their lives begin to deteriorate. Some of them we can help, others we were not able to. But I tried a lot to work with their minds, with their words, with their spirits, to encourage them to fight. Because once people give up once they give up the fight on the inside, the fight on the outside is pretty much lost. The medications, the treatment we're giving them is not really going to work very well. So yes, there's a lot to be said about the subconscious and the inner workings of the mind and the spirit when it comes to health. Dr. O.
Thank you so much. I beg to, just comment on that. Our forefathers, you've got to remember that their lifestyle was different from ours. A lot of our forefathers were farmers, hunters, and these are things that required activities. So they had to be able to get up and prong up and, do all of these things. Then the horses came and people started riding horses. That's still some exercise. Then we got cars. And when you drive in, you do less, you don't do any exercise, as opposed to when you're out there in the field. So the lifestyle had changed. And even now, look at us. We exercise some, some of us do focused exercise. We register in a gym. Some of us do 30 minutes walk every day, every other day. But just see the generations coming after us. They do same thing. A lot of them go to the gyms and all, but they sit down a lot on the computer. It's computer age. We excited to work from home. I love to telemed from home, but I'm realizing that unless I incorporate some sort of exercise of some sort into my life, when I telemed, I'm sitting down there from morning till dusk, working and seeing patients, not getting up to exercise. So there's been a change. Plus, what they ate were organic. They produce food on farms that, and they use manure. I remembered when I was in elementary school, when we were going to get cow dung to put on farms, that they were teaching us how to grow things. And that was what we used for manure. Now it's different. It's chemicals that are used to accelerate the growth of plants. Where do we think those chemicals are going? They go in, we eating all of them or some of them somehow. That's when you start saying these are organics, these are not organics. What is in what? So diet has changed, professions have changed. I've seen people who come from Africa and they're vitamin D deficient. I remembered, I've said this before, Medical Mondays, an aunt-like person who came from Nigeria had vitamin D deficiency. And I said, wait a minute. You have the sun. I know you have melanin that shields you from the sun, so you're not getting a lot of sun, but you should get some. Why are you so deficient? She said, your lifestyle is not different from mine. I get into my air-conditioned, I get from my air-conditioned house into my air-conditioned car and into my air-conditioned office. And when I'm done, I get back into my air-conditioned car to go. I'm like, you know what? I'm sorry, ma'am. You're right. She's right. Lifestyle had changed. Think about it. Chris, you are in Nigeria. You do the same thing. Air-conditioned car to air-conditioned house.
That's true.
So that's what the issue is. The lifestyle of our forefathers are different. And Dr. Ajibade, please, I know that you've lost some weight and you look amazing. The BMI of Black people, the people that were used to devise or develop the BMI we use now in clinic are not Black people. If you look at Black people, you see that Black people are large boned.
And heavy bones.
The Black people are, the large boned as compared to our Caucasian counterparts. So you need, that extra flesh to cover that bone. So our BMI are not, appropriately reflected in what we use right now in the tool. So most of us doctors look at you and, extrapolate somehow to advise and educate. So you lost weight. Before you were obese. I didn't like it, but now I think you're good.
Thank you.
I
appreciate it.
You're welcome. Dr. Okweyemi, Dr. Adewale Okweyemi, all the way from Nigeria also, kindly unmute to ask your question. Thank you. Welcome.
Yeah, thank you, Dr. O. Good evening, good morning, good afternoon from wherever we are. I'm excited to be here once again. I would like to appreciate Dr. Ajibade for another presentation on this platform. I just want to quickly add that, I read an article a while ago. Sorry, I joined the meeting a bit later than when it started. The issue of GIT as the second brain. I don't know if you have come across something like that. GIT has been recognized. GIT, I mean gastrointestinal system. For some of us that might not be made, the gastrointestinal system has been recognized as the second brain. Wow, I said, why science can never be ahead of the Bible. The Bible says, out of your belly flows rivers of living water. Now, like, what is happening here? I began to read along that line, and we find out that in GIT alone, there are billions of bacteria. Billions of bacteria working together, all these things are what is affecting our health. So I just want to emphasize at this point that the problem of health is coming, especially these chronic diseases, is a function of low-grade systemic inflammation, inflammation of the body that has been there for a very long time. Maybe some people 15 years, 20 years, 30 years before it eventually showed up. Now, the issue of this inflammation, at times it is worrisome for me in Nigeria, because I noticed that most of the food things that are anti-inflammatory are things that are very, very expensive. You see fruits, people cannot easily fruit are not easily accessible. And the food that we think that, oh, this one is a rich man food, they are loaded with sugars, loaded with all sorts of salts. And you're not like, what's happening here? So I want to say that I don't know how we are going to change the paradigm, especially in Nigeria, in the sense that our consumption that are contributing to inflammation has to reduce, so that all how it affects the systemic health can be addressed. But I don't see in nearest future anything that is being done in that line. Another thing that I just want to say, yes, I'm a dentist. I want to talk from the perspective of that oral health. And Dr. Ajibade rightly mentioned the importance of oral health. I can tell you that there are ongoing researches that is stating that what you have from the periodontal disease underneath underneath your gum actually is contributing to the inflammation we are talking about. For example, there's this bacteria called P. gingivalis. This founder is found to be in any of all the chronic diseases. They found that this particular organism is being isolated, and is let me tell you where this particular organism resides. It resides just below our gum. So it's very, very important. I want to conclude that the concept of inflammation is the way to go about some of these health issues. And what we eat, like what Dr. Ajibade has mentioned, more importantly, those medications, because vitamin D is antioxidant, vitamin C is antioxidant. So, and this antioxidant, I mean anti-inflammatory K, helps the blood clotting system, all these things. By the time we begin to, but I don't know how we are going to get there, because our lifestyle, everything is just pro-inflammatory. We are increasing the load of inflammation in our system. It's now worse in Nigeria because we don't have opportunity to check. We don't have to, not that we don't have to, those things are not there, but they are expensive. They are not routinely done. Just like Dr. O mentioned, if you are in US, they are checking your vitamin D regularly. In my practice, how many times? But by the time I mentioned that, okay, let's check the vitamin D of this patient, people like, wow, what you know? But all of us know in theoretical wise that vitamin D is very, very important, not only for bone. It's even knowing that vitamin D is anti-cancer in its operation. The whole thing is boiled to the fact that inflammation, if it's not well controlled, it will continue to affect some of our other systemic diseases. So I want to stop here and just ask a question. I have already put the question on the chat box. Dr. Ajibade, sir, the issue of dementia. Yes, theoretically, they said brain neuroplasticity, this disease. From your experience, to what extent is dementia reversible? Thank you very much.
Your question actually read, to what extent is dementia reversible, especially when it is caused by prolonged hypertension? Correct?
Yes, ma. Thank you, ma.
You're welcome. So, Dr. Ajibade, the floor is yours. Thank you so much for your contribution. Thank you. It goes back to tell us about diet.
Yeah.
How to eat
well,
right.
Thank you, Dr. Adewale. Those are very, very salient points. Very, very important. And you're absolutely right about inflammation. That's the underlying thing. In fact, Time Magazine said inflammation was, it was on the cover of the magazine, and it was like, this is the silent killer, and so on and so forth. And I would say about 97% of all diseases, chronic diseases, has inflammation as an underlying factor. And that's why I pointed out, and you pointed it out too, the vitamin D, vitamin C, and even zinc, maybe it's a few of the other ones, are anti-inflammatory and antioxidants. And that's why I recommended them. Now, obviously, there are more, and those are the cheapest you can get. That's why I push these so much, because I know that most people cannot afford. I take omega-3. This cost about $60 per month. The other ones that at one point, the company that makes this, they were donating to us. Their bottles of the oil was like $100. We're giving kids free of charge 2 or 3 times, 2 or 3 bottles a month. So that's like $30 a month, amongst other things that we're giving to kids back home to address their brain disorders. And speaking about, so our foundation, those of you who are people in Nigeria, we still run free clinics in Abuja. And if you're not in Abuja, we can ship them to you free of, well, you have to pay for the shipping, but the supplements and the things are free of charge. And they address inflammation amongst other things. But going to your point about the gut-brain connection, the majority, a lot of what we do, whether for kids with sickle cell disease or kids with cerebral palsy or brain disorders, our approach is really dependent on the gut-brain connection. So what you said was very, very important. We address many of the brain conditions that we have in kids. We address them by starting with the gut first, because it's easier to handle gut problems than brain problems. Well, once we begin to handle the gut problems, and by the way, they're using that same approach for autism now, and even for dementia now, we begin to see addressing the gut. You must not, if you're dealing with anything concerning the brain, you must not ignore the gut. So the gut is very important. Now, to your question about dementia, yes, it is absolutely reversible, regardless of the cause. Whether it's hypertension, whether it's toxins, whether it's hormonal imbalances. And we have on our website, we have what I call the dementia's dirty dozen. So there are about 12 major factors, and high blood pressure is one of them that puts you on the pathway towards dementia. So it's important. Some people are affected in different ways. Some of them is hypertension, other people is blood sugar, other people is hormonal problems like the menopausal issues. Some people will be mental illness mental stress that can lead them to dementia. So all these different things can approach it. So yes, it is possible. Obviously, you want to address the hypertension and the cardiovascular disorders. You're not going to have any improvement in your dementia if you don't address that. But on top of that, you've got to also address fixing or nourishing the brain, nursing the brain back to health, which means feeding the brain with the right nutrients, feeding the cardiovascular, addressing the cardiovascular system, addressing other systems that affect the brain. So it's a multi-pronged approach. But like I said, if you're concerned about the one with high blood pressure, you have to address the high blood pressure, and then you have to work on improving the cardiovascular system, healing the blood vessels that supply to the brain. Because what high blood pressure does is that it damages the blood vessels in the brain, which contributes to the dementia itself. So we do that again. Like I said, the federal government has given us permission to use our approach for the building strength approach to address dementia in Nigeria. We've gotten quite a few testimonials successes with regards to that.
Thank you so very much. I'm going to call next, you have priority when you raise your hand, So Mr. Ayotunde Adebayo, I hope that's a Mr. because that could be Mr. Mr. Ayotunde Adebayo, kindly unmute to ask your question.
Good evening, everybody. Good evening, Dr. Tony Opesami, my aunt, Shalafia Lewa.
Alafia Neo, thank you. Good evening.
I was on the highway when I started, listening to everybody, but it was Dr. What did you call his name? Dr.
Ajibade.
Ajibade was the one that was, making some narrations, and I was following everything in detail. But my question, I want to give kudos to him for some of the things that I heard him say. So my first question is that, number one, I'm very curious and very, very careful in taking medications and also going to see the doctors for any reasons. I haven't been to the doctors since I came to this country, except for when I had an abdominal pain. And, I went to the hospital downtown Baltimore, and, I was treated. And by the time they treated me, what they gave me wasn't that something that's very serious. And then, I get better. Now, my question is this. on the vitamin D. If someone has a cracked bone, let's say you did an X-ray and the X-ray is showing that you have some cracks in some part of your bones inside. Is there a remedy for that, or will vitamin D work for someone of that nature? That's number one.
Okay,
I thought you want to be answered.
Wait, you said number one. If you have a cracked bone, when you say cracked bone, I'm not sure. You mean a fracture? You mean a fracture or what?
Okay, it's me that has that issue on my bones. I'm not sure if it's what led to because I have sciatic nerves, but I've been doing swimming and I take a leave. And to be honest with you, when I take a leave, before I can get relief from that pain, I have to take 3, maximum of 4. But when I took it, it stays and works in my body for maybe a week or a week plus. And then sometimes when, that pain really comes, I don't even use the alley. I drink a lot of water. So probably I need a consultation, for this. But since this topic is on, that's the reason why I said, let me take the opportunity of asking that question about, can vitamin D also act as a supplement, to help with like cracked bones? Not really cracked. I don't know how to describe it. Like,
okay, is it like Charlie horses, like you get paja?
No. Do
you have a fracture?
When I'm talking about the sciatic nerves, it affects you sometimes from my butt,
from the low back, down to your leg,
lower back, then to the back of my heel. Back of my what do you call it?
Yes.
So it's like a pinched nerve or something.
No, that's sciatica. Talking about sciatica. So that is sciatica. But tell us about that cracked bone, because that has nothing to do with bone.
So the cracked bone, I saw that in my X-ray. So the doctor said to me that maybe it was the age issue and stuff like that caused that. But is there a remedy to fix those? It looks like a choppy, like dot, in some areas, like, maybe on the upper side of my, you call it cervical or something like that?
So it seems as if you're having bone spurs. Would that be accurate, Dr. O?
No, okay. They're not bone spurs. So we don't establish doctor-patient relationship on this platform, but we will channel you correctly, right?
Okay.
So it's difficult to say what you're trying to discuss on that X-ray, but if it's indeed a fracture, like I think it is, there must be a reason why you will fracture. You would have a fracture without trauma, without falling or being hit or something like that. And we talked about that earlier, that vitamin D deficiency can cause osteoporosis, which is a bone disease that causes the bone to be brittle. And people can fracture without having an accident or incident to cause that. Mary here, she's an NP in the medical profession, says she thinks you're describing osteoarthritis, and it's possible. Again, unless one sees the X-ray, it's difficult to say, and it's difficult to answer that question specifically. However, I want to encourage you that doctors are actually your friends. It's very important to see a doctor like once a year and do the preventive things. The reason this platform exists is to prevent. See, once things had happened, it's harder sometimes, most times, to take care of. We do fantastic with prevention. So at least, in the US, we trained to screen to prevent. In fact, in medical school, we were taught that we should not screen for something we cannot intervene in. So when we screen you, we have intervention. It's why we're screening, and it is important. I have private chatted you. Read that private chat.
Oh, okay.
Have access to that? Okay. Read that private chat and we'll continue dialogue. Okay. But, we have to discuss specifically, how to intervene here. Okay.
Okay.
Did you see my chat?
Yes, I saw it.
Fantastic. Okay, cool.
Can I ask the second question?
Absolutely.
That's the last question, actually. So, what about when one stands for too long and, it leads to that lower back pain? What is the cause for that?
Dr. Ajibade, you want to answer that?
Well, yeah, sure. So,
I can if you don't.
yeah, go ahead. I mean, it's part of the whole wear and tear thing. I mean, when you carry that kind of weight, low back pain is one of the commonest diseases. Sorry, not diseases, but disabilities on the planet. Other than headache, I believe it's depression and low back pain. I think they're both competing, one or the other. So
low back pain. Low back pain takes the lead. And
it takes the lead. Yeah, because that lower back area, you're dealing with a lot of weight over time. You're sitting on it. You're walking around with it. You're carrying things. Mostly, you're not carrying it in the right way. And you have to don't forget that the lower back has very poor blood supply. And anywhere you have any area where you don't have enough or adequate blood supply, it's likely over time to degenerate and to not recover like it should. Now, our faces have a lot of blood supply. So if you have a small cut here, it bleeds quickly and it heals. You have the same problem with the low back pain, with the wear and the tear and the movement and the weight and all that. It becomes to take longer. That's why chiropractors are doing so well in the US. Can you believe, Dr. O, that there are those 2 chiropractors in the whole of Nigeria? Those 2 chiropractors. I learned the value of chiropractors because I was a champion. I was a state champion in racquetball when I was in the US many years ago. And I played it so much that eventually I injured my back. There was one time after the game, I couldn't stand up again. I had it was like when they did the x-ray, my one vertebra had shifted over the other. For a whole year, I had to go through rehab with of course, I wasn't going to do surgery. Why would I do surgery? So I went to the chiropractor. And the chiropractor put me back together again. So if you're in the US, one of the recommendations I would have, if you have low back pain, is to manage it conservatively. And I would recommend you visit a chiropractor, even if it's just for a few sessions, so they can tell you what this is.
I'm a physician, and so I'm going to stick with the straight and narrow. I'll tell you this. One of the number 1 treatments for back pain is exercise. So the reason why you stand when you stand for a while and your back hurts, it's most likely because you don't exercise. So it's not really wear and tear. It is lack of exercise. So the body is not used to that, that standing in itself is exercise. You hear people say you burn more calories standing than sitting. There's a reason why. So when you stand for long, your body is not used to it, you're going to hurt. If you start exercising today, take this to the bank, you're going to come home. If you don't hurt that day, the next day, you probably won't be able to get out of bed. You will hurt. That's why when people start exercising, we recommend do it every other day, because the next day you're going to hurt. And then, give your body a rest for the next day, and then exercise again the day after that. And then, continue like that till you get used to it. But when you first start, it would hurt. So exercise will help that back pain when you stand for long. And I agree with Dr. Ajibade, conservative measures. That's one of it, exercising. And it's simple, even just brisk walking, 30 minutes, start every other day is helpful. It's cardiovascular exercise, but it would also help. If you can carry a little bit of weight, maybe you're a man, 10 pounds, maybe 8-10 pounds, while you're walking and, moving that, it exercises the upper body also. So that'll be my take.
It's going to need for the lower back, the kind of exercise, Dr. O, is you're going to need a lot of core exercises, things that strengthen the abdominal and the back muscles, not just any kind of exercise. They're going to need to strengthen the muscles around that vertebra to rehabilitate it.
That core. Thank you. So, and you know what? There's a lot on Google that can help you with those core exercises. Dr. Ajibade is 100% correct. I agree. I concur.
Right.
So, Dr.
Finally, we agree on something.
I thank you very much for the response. I really appreciate everything that I had.
Thank you.
Thank you very much. And then thank you for bringing this program up. I'd like to see more of these.
Thank you.
Very much.
Thank you.
Okay.
Look forward to that. Thank you.
Okay.
Dr. Ajagbe, kindly unmute, sir, and ask your question.
Hello.
Welcome, sir.
Dr. Ajibade, how are you?
Fine, thank you, sir. Good to see you, sir. How are you, sir?
Yeah, I have three things, just a little bit of addition. One is, whenever we're talking about vitamin D, vitamin D3 is what is being talked about. So, and then it's been found also scientifically that vitamin D3 and vitamin K2 are very important to work together. So it's best to have a combination of D3, K2, as a supplement to use for effective utilization. So that's number one. Number two is I wanted to just ask a question.
I think it's in an area that is not, the internet doesn't seem to be stable. I'm sure it will come back in. He said he was going to ask a question. That D3 and K2, it's expensive. I bought it. It's expensive. Yeah.
Doctor, are you sure? Because I think I got mine that was less than $20. So, and this is about 250 capsules on Amazon.
Right.
Where do you get your?
Oh, I didn't buy it on Amazon. I bought it at Giant. And
that's your first mistake there, Dr. O.
I get you. But do something for me, please, while I'm going to ask Dr. Izugu, just heart, to unmute. Can you put your website in the chat box, please? So that you can have access to that. Thank you. I appreciate that. Dr. Izugu, welcome, sir.
Welcome. Greetings, everybody.
Lord is your strength. You still at work.
Amen. Yes.
Hello, sir.
Hello. Thank you really for the presentation, Dr. Ajibade. That was really beautiful. I want to just make some comment on the hypertension aspect. And it's on the comment on the inflammatory process, which has been highlighted. Many of these conditions, diabetes, hypertension, all of them create inflammatory processes. Yeah, many a time,
May I say something, Dr. Izugu?
Sure.
Dr. Izugu is a cardiologist. For people who have forgotten or have not met him, an amazing cardiologist. I'll say more when he's finished. I just want you to know, so you know the authority speaking to us.
Thank God. Yeah, so we deal with these conditions, and we do, let's say you diagnose high blood pressure by looking at the number. You diabetes by looking at the number. These are just a way of telling you that these conditions are present. However, they carry with them what we call pathology, which is how they affect the organs. And many a time, these inflammatory processes tend to happen at the very end organs, the very, very tiny blood vessels, capillary level, the tissue cell level. And so many a time, in managing these conditions, first, it is really very important that we protect those organs. You know, the little ones, those brain, the eyes, the kidney, the little vessels that go around the heart and all that. And then secondly, we have to then try to bring the number down, which means getting that blood pressure, instead of it being 180, you know, bring it down to maybe it's 120. There is a difference in the idea of bringing the number down and also the idea about protecting the organs. Just imagine in your home, you may have a safe in your home where you put the most important things and seal it. Now, hurricane can come or fire or whatever, can take the house down, but that very safe is not affected. So in managing these conditions, we try to put medication that protect those organs and then give medications that reduce the number. When it comes to us as African-American patients, Africans and all that, you're gonna find that, yes, there has been research, there has been, you know, issues on these medications and the varieties on how different things are. But I have to tell you there are key things we have to understand. There are certain medicines that protect those end organs, and those medicines work alike for everybody. The mistake sometimes we may think is that by just bringing the number down, that we are protecting the organs. That is not the case, because some of the medicines that bring the number down, such as even clonidine, or even the calcium channel blockers and the hydrochlorothiazide, they're diuretics, they may bring the number down, but they do not protect those end organs. So you may find that we may bring the number down, but they still have to end up with dialysis, blindness, dementia, all of those things do happen. And certain medications that really protect those organs, we don't use them often, and we use them a lot on the white populations, okay? And among them are things like what we call ARBs. You know, there's also the MRAs, like spironolactone. We also have, of course, beta blockers. We also, you know, there are many of them. And so it is important that when we treat blood pressure and diabetes and endocrine protection on, on our patients, we should try to do that combination of those medicines that protect those organs, and then give them these other medications that we know are very potent in bringing the numbers down. Mm-hmm. So I will encourage the use of medications such as the thiazide, the diuretics, and also the calcium blockers. Please do them in the presence of medication that protect the end organs. That's very, very important. I'll stop there.
So thank you so much for that.
Go ahead.
Oh, sorry. Can you, so the ARBs and would the ACE inhibitors be amongst them, or is just the ARB?
No.
I mean, can you expatiate on that a little bit?
So let me, again, I don't want to take this discussion outside because, we have mix up of people. We knew about ACE inhibitors a long time, but ACE inhibitors, they don't work at the cellular level, receptor level like ARBs do. And what happens sometimes is that we give ACE inhibitor to an African American, and all of a sudden they get angioedema or swelling or cough, and then we put on their record they're allergic to ACE inhibitor or lisinopril. And once that goes into their record, then they don't get any ARB or any other medications which we use to protect those end organs. So in our own practice, we really prefer to use ARB right off the bat in protecting those organs than the ACE, because they do get side effects from it. And many of the medicines that we use to prolong life, prevent heart failure from happening, or even manage those patients who already have heart failure and reduce mortality, those are the ones that really protect those end organs. And you're gonna find the ones that would end up throwing at the patients just to bring the numbers down. We do that to bring the numbers down for them to feel good about it, but we must protect those end organs. It's very important.
Thank you. Thank you so much. Thank you, because you gave the last talk you gave, I was so petrified. I got into clinic, and every patient I saw for like the next month, I was looking to see how I manage them. And I praise God, because it's only God. It can only be God that 95% at least of those patients were on calcium channel blockers that will bring down their blood pressure, and also on ARBs, not ACE inhibitors. I shied away from ACE inhibitors not from research or anything, in my Black population, because I was seeing a lot of side effects that are life-threatening. We call it angioedema. They end up in the hospital with, this, swelling of the vessels, can't breathe. And so I just stopped using ACE inhibitors in my Black population. And I use ARBs. I found out, Dr. Ezugwu, because a lot of our people have the diastolic, that's the bottom blood pressure, that are high. So you control the blood pressure, but you still see that bottom number is in the 90s. And I know that ARBs target that bottom number. That was before you talked to us about the end organ damage that they actually prevent or protect. So that was why most of my patients were on that combination. And when I started seeing them, like, I needed to tell Dr. Ezugwu this, and I kept forgetting that I'm on target. But it's really bad because I didn't have that knowledge that about the end organ protection. I just was treating what was real. I wanted both the systolic and diastolic pressure, that's the top and the bottom pressure, normal. And I was picking medications that research has shown do what they do. So thank you for that admonition. I'm sure, and I know that is to doctors on the platform tonight. I pray that we all take it to heart and do the needful. But just treating blood pressure is not enough. I tell my patients that treating it to goal, and also protecting that end organ, the end organs is very important.
Excellent. Thank you.
Thank you, sir. Thank you, sir.
Sure, thank you.
Sister Remy or Mr. Remy, kindly unmute and ask your question. Kindly unmute. Thank you. Oh, you muted again.
Can you hear me?
Yes, we can hear you now.
Thank you. Thank you.
Uh-oh.
Well,
that is my cousin. Why do you always do that?
How are you doing?
It's my big bro. Okay.
Well, I'm going to try to make this very, very simple. Since I'm not in the medical field, but I've lived long enough to be able to identify a couple of things. I believe, like my mom used to say, whatever thing you eat at 20, that's exactly what you're going to be at 40. So I'm always very afraid of taking medicine. I don't like taking medicine. I don't mess with it at all. I just finished playing soccer like an hour ago. That's why I come back a little late to the program. And I'm 70. So
wow.
I feel good. So, and I will tell you.
It looks fantastic, by the way. Fabulous. If I may say.
My question is this. How can we incorporate the proper food with medicine? Because I know every medicine has a side effect. So, but food do not have a side effect unless you eat too much of it. Then you're going to get sick. So how can we incorporate that to correct some of these issues that we have? Thank you.
Dr. Ajibade, do you want to tackle that? Although I want to say food can have side effects. We have people who are allergic to certain foods. So that's another story. Don't worry. I'll bring somebody to us to talk to us about those, about allergies. We are in the allergy season. So we should address that in one of these sessions. But you're right. I see your point though. Go ahead, Dr. Ajibade.
Yeah, thank you for that question, sir. So it's a wide range, like Dr. O said, different people react in different ways to different foods. But there are some basic principles that I always try to push out as much as possible. And I may take a different view from Dr. O. Most important, as we grow older, you need less and less of carbohydrates. And I know most of us are Nigerians or have a Nigerian background. We grow up eating starchy foods, and we tend to keep to continue the same amount or the same serving of amala or eba that we used to take when we were 25. I would say you want to start reducing that to less than half of what it was. Your body really doesn't need that much. So that's one principle. You want to severely reduce your carbohydrates. I'm not as big as hawkish on meats or on fatty foods. You want to stay away as much as possible from processed foods. I know that's very, very hard, but you want to stay away from those things. But you want to take as much as vegetables, even fruits. You want to start reducing your fruits because fruits contain a lot of sugar. Yes, it's natural sugar, but it's still sugar nevertheless, and that's still a burden on your body. But probably more than anything else that I really want to emphasize is the fiber. Our bodies need fiber. And really, that's not accurate. Your bacteria, the other doctor mentioned it, the bacteria in your gut need fiber. And once you give it to them, once they are happy, you'll find out that a lot of things work better. Among the things that fiber does is that fiber certainly helps with your insulin levels. It helps to regulate your blood sugars. So whatever sugar you have in your body, it helps regulate that. But again, the more important thing is that the bacteria need it. Once you give them the bacteria the right kind of foods and they digest it and they are happy, they will produce chemicals that are helpful to your brain. They will produce chemicals that help to regulate inflammation. They produce chemicals that destroy other bad bacteria and viruses. They will help with your digestion. They will help to seal and protect the inner layer of your guts. I mean, there's a host of things. So what I always say is that eat intelligently. Personally, I don't eat for nutritional value because, quite frankly, from what I know, nutritional value of most foods is not what it used to be, like I mentioned before. Eat to enjoy yourself, satisfy your hunger. Don't eat too much. But more importantly, you eat to feed your good bacteria. Because if you feed and take care of your good bacteria, and that's another talk on its own, your good bacteria will in turn take care of your brain and your body.
Thank you so much. Brother Remy, your question is on point. We must couple excellent diet, not just good diet.
Yeah, the reason why I asked the question is because a friend of mine is diabetic, and over the weekend he was rushed to the hospital. Then I told him, you need to eat green vegetable to clean out your system because he was having some pain. I'm not a doctor, but I tell him, look, if you stool regularly, like a normal person, you shouldn't have a pain in your stomach unless you have whatever you call that one, appendicitis, something like that.
Appendicitis.
There you go, that one. So unless that, everything when you stool, it should be normal, and you shouldn't have a whole lot of pain. And you eat something green, like it's good for your digestive system. So yeah, I just figure I don't like medicine. I don't take no medicine. I'm fine. I stay away from it, But the food that I eat are very expensive because you go to Whole Food, you try to eat all this organic, which some of them are really organic, but they call it organic, but it is what it is. So thank you.
Thank you so much. And I must say, every one of us on this platform, I'm sure we appreciate you for serving. He served in the U.S. military, was deployed to Afghanistan, Iraq, all of those places when they were bad is when he was deployed several times, over and over again. And he was always smiling, still always smiling, defending us. Thank you so much, sir, for serving.
You're very welcome. Thank you.
Thank you for your service. Yeah.
Dr. Ajagbe, you can ask your question, sir.
Hey, sorry, I lost my battery power.
Yeah, your question. You were about asking the question and then.
I can't hear you though. Anyway, so the second question the question I was about to ask before my phone died was, Do you have any recommendation for an elderly person who is recovering from brain surgery? Dr. Ajibade, do you have any supplement, compounded for recovery from brain surgery?
Was the surgery for cancer or was it for something else?
No. It wasn't for cancer. It wasn't a recession. It wasn't a resection. It was just a vascular treatment.
Okay. Without knowing much about the person, so obviously I'm just going to give generalities. The most important thing for recovery from the brain is the high good concentration omega-3s. Now I say that with a caveat. If the person is on blood thinners, omega-3s can increase the level of thinning of the blood. So that's the caveat to that. But if he's not on blood thinners and it's okay, I would say omega-3s. And like I said, there's only one brand that I use because that's the one we use on kids with severe brain damage in Nigeria. And we got great results. And the person who formulated it is a personal friend and mentor of mine based here. So that's the number one thing. Obviously, the other things are the vitamin D. I can discuss the doses with you, but maybe not here. Vitamin D, the vitamin C, and the zinc. These are and of course the B complex vitamins, especially B1 and B5. Extremely important for brain recovery. But if you want to discuss that further, maybe we can do that offline. But they will need to take high doses of certain things over a period of time to get the brain to kick back into life and recover properly.
Okay.
But,
I think we should connect.
Okay, sir, offline. Thank you, sir. Thank you so much. Thank you, sir. Sister Rosemary.
Good evening, everyone. Good evening,
Dr.
Ajibade. Thank you very much for a great presentation. I just want to ask you a question about cholesterol. What about omega-3? Is it good for cholesterol, to control your cholesterol?
Yes, omega-3s are good for the cardiovascular system. I like to so as omega-3 is very, very good for your cardiovascular system. And I like people to think in terms of cardiovascular system, in terms of cardiovascular health as much as possible. Cholesterol is actually a good. I think when you say when people say cholesterol, they don't realize. So LDL is not cholesterol at all. It has nothing to do with cholesterol.
Are you serious?
Yes,
are you serious?
LDL is not cholesterol, ma.
What is it?
It's a lipoprotein. It's a carrier of cholesterol.
Okay, you know what? For the purpose of our audience, otherwise we're going to go to science class. So for the purpose of our audience, we have the good cholesterol, that is the HDL. It protects the heart. Then we have the bad cholesterols that are triglycerides and the LDL. So, doctor, advise us on those.
Okay.
Please.
Fine.
Thank you.
Okay, fine. So yes, omega-3s will help. If your doctor has prescribed a statin and you're concerned about taking a statin, omega-3s will help. Nobody can advise you against what your doctor has said. However, if you're on a statin and if anybody's on a statin, you must take CoQ10 along with the statin, because statins, as a rule, remove that CoQ10 from the body, and that results in muscle pains. It affects the liver. It can even affect the brain adversely because of what the statins do. And I feel it's to be regretted when doctors prescribe statins or cholesterol-lowering drugs without providing the protection that they do, without providing for the imbalance in terms of CoQ10. You can check that out. So I don't know if that was your concern, but omega-3s definitely will help. Now, the other thing with LDL, bad cholesterol, quote unquote, is that the more it rises when you take sugar and carbohydrates. So if you want to reduce your cholesterol, your bad cholesterol, quote unquote, you want to reduce your starchy foods and your carbohydrates. Most people can live without carbohydrates, quite frankly, but most people have to take it. So please, just those are the points I want to give. You want to take CoQ10, you want to reduce your starchy foods and your sugar intake. And yes, omega-3s are very good. They can also help with cholesterol levels.
Perfect answer. Thank you very much. I'm satisfied.
Thank you. So what about fish oil?
That's omega-3 now.
It's omega-3. Thank you. See, I learned something. Thank you. I appreciate that. So
No,
in the chat box, our brother Tokwe asks, in the move from ICD-9 to ICD-10 a few years ago, a lot of new diseases and diagnosis codes were added to the dictionary. After the recent wave of violent deaths of Black people directly resulting from racist police and citizens, what are the chances of an ICD code being created for this? So I will answer that question. I don't think it's a fair one to throw to you. Do you want to answer it?
No. Please go ahead. Be my guest.
So ICD-10 is, a new lifestyle in coding for whatever we treat our patients with in clinic. We have to find a code that goes with it. So for deaths like this, violent deaths, I don't think there's an ICD-10 code for it. I think there'll be something like uncertain death or something. It's in the ICD-10 code. Is it possible that is there a chance that they will create one for this? I don't know. It's not a question that I can answer. I don't even know if the ICD-10 is being updated, anytime soon. It took years for them to come up with what we have now. And I'm not sure if that will be added. But, I totally get you. I understand where you're coming from. Does somebody have a comment on that? Because I heard something. Okay. So, Tonya Jayid said there is ICD-10 code for blood pressure. Yes, there is. It's I-10. That's the diagnosis. And for elevated blood pressure, when diagnosis of hypertension has not been made, it's R030. So these are just codes. They're just numbers that make sense to medical professionals and billers as well as insurance companies. That's the relevance of that. So Francis Alu asked, how do you address issues of pains at the knee? Could it be as a deficiency of vitamin K or arthritis? Dr. Ajibade.
Yeah, so pains in the knee, different factors involved in that. A lot of it is, some of it could be due to wear and tear. Others could be inflammation from former injuries. I mean, one of the reasons why I gained so much weight, Dr. O, is because I injured my knee playing squash and I could not exercise again. All I could do was eat. And that's why I gained so much weight. But vitamin D doesn't help with regards to the joints. What vitamin D is for the bones. But more importantly, if you're concerned about putting calcium in the bones or in the joints, it's not vitamin D helps to a certain extent, but it's not. I think the more important ones would be like the collagen and the what are these called? Chondroitin sulfate, hyaluronic acid. Chondroitin sulfate, hyaluronic acid. There's some combinations of supplements that help to heal and repair the joints. I had to use some myself. Other than that, the medical field, medicine only has the pain relievers and the anti-inflammatories. But in terms of specifically healing joints, that would have to be, the ones I know of are not medications. The ones that are more like nutrient complexes that help in the repair and the regeneration and the restructuring of the joints. So that's what I would say about that. I don't think vitamin D can actually, if you're dealing with joint pain, and I don't think vitamin D can do that, or vitamin K. You would need a nutrient complex, which is what I used.
Thank you. I would say you need evaluation first.
My mistake is that I always assume some people are in Nigeria when I'm talking to them, and that they don't have access to a professional. So I apologize. I just assume that people don't have access to a professional, and I just wanted to help them with whatever I can help them now. But sorry, yeah, absolutely right, Dr. O. They need to have.
I would like an X-ray and an MRI of that knee to see what is going on, and then we would intervene. So it needs to be evaluated because there are different reasons why one would hurt. So Tokwe asked again, within the Caribbean and African American community, some maintain a belief that your food is your medicine. They embrace the use of herbs, which is a throwback to their African roots, which many Africans themselves have grown to shy away from due to the non-conformity with Western medical standards. How much of the formula in the Western medicines are derived from the essence of African herbs and roots? Excellent question. Go ahead, Dr. Ajibade.
Yeah, so I think it's, so you have the Eastern and the Western, or the African and the Caribbean, and the more native, obviously the more native foods that have been known through generations to be healthful for different parts. So this is more like the native wisdom and the wisdom through the generations that have helped. The problem with those is that they can't be quantified. They haven't been tested. They haven't been tested over time. So yes, while some of them work, you don't know unless you have the native doctor himself next to you, or the formulator themselves next to you to give you the exact what they know works for this kind of person. They won't. There are shortfalls, there are shortcomings to that approach. I think the best is the merging of the two, the combination by someone who knows what they're doing, to take from the Western approach by nature is quick, it acts quickly, it addresses the problem, but it doesn't do it in a way that is holistic, let's put it that way. So it just addresses the problem. Meanwhile, the body is an entire system. And so the body needs, that medication can throw the rest of the body out of balance. And it may take some time for the rest of the body, the hormones, the neurotransmitters to come back into balance. So the ideal thing is a merging of the two, and someone who knows how to use the medication and the surgery and the treatments appropriately, but at the same time, after the treatment has been done, helping to provide the nutrients, the nutrition, whatever it is, to help the person recover more quickly. Because I think that's a problem. That's where the Western medicine is lacking. Western medicine is very good for emergencies and for treatment of infections and so on. those acute problems. But when it comes to the chronic issues, we fall short, sometimes terribly. So again, it's the combination of the two that is ideal. Dr. O, over to you.
Dr. Ajibade, you and I tonight, I don't know what this issue is, but I'll tell you, Western medicine, we do well in preventing. You know, take hypertension, for instance. You heard Dr. Izugu. We use combination medications, sometimes just one, and we control the blood pressure and then save the end organs. When we keep saying end organs, those are the kidneys, the eyes, the heart. We save them with this medication. So we do well with the medications if people are compliant and if we diagnose early enough. You know, it's when things had happened with traditional medications, Western medications, it becomes tougher when somebody has had a stroke or, congestive heart failure. Exercise tolerance goes down. It's difficult to fix that. But coming back to Tokwe, the main question, how much of the formula in the Western medicines are derived from the essence of African herbs and roots? Believe it or not, a lot. Sometimes when I educate my patients that you go to health food stores to go buy vitamin Ds, to go get all these, things you say, supplements and all of that, that the medications that we prescribe also, they're from the soil. We use fillers. They use fillers to make them tablets or capsules, the same way that fillers are used to make the ones you buy in this, old food stores. So believe it or not, a lot comes from the African herbs and roots. I'm finding out some things recently that, our Western people are very smart. They're very intelligent. They take what is important from Africa and they make it into palatable things that they then sell back to us. Medication is included in that. That's my. Do you agree, Dr. Ajibade?
Wholeheartedly.
See, we agree on that one too. Yes.
We're on a roll. We're on a roll.
So, Dr. Ajagwesa, you can unmute. You have your hand raised before I go to the next question in the chat. Thank you, sir.
Okay. I have two more comments. One is about the involvement of the Blacks in research. I know that was discussed earlier, and I think if anyone is familiar with the historical Black institutions in America, you will know that most of the research projects being awarded by NIH and some other foundations are targeting, African American population or minorities. So at least for many years that I was involved in that, I know that for a fact that certain research projects are awarded by NIH through HRSA and through NIH directly to historically Black institutions in order to address the disparity in involving minorities in research. So, and one of the ways to ensure, that they've been ensuring that there will be no foul play or the guinea pig, fallout is that there's what is established universally in research that is called Institutional Review Board. The Institutional Review Board will review every research project proposals to be sure that the rights of the subjects who are participating in the research are not violated and that they are not being used without mindfulness on the part of the investigators. So I think the issue will be whoever is interested can always find information NLM in Bethesda is open to the public. NLM is the National Library of Medicine. And so anyone who really wants to know about how research is impacting the management of African, the minorities in America, you should be able to take a trip to NLM and find out some things. Now, the last thing I wanted to ask Dr. Ajibade is that I wasn't able to join at the beginning, but I'm sure you addressed the topic exactly the way it's written. So could you just, for the sake of others who might have joined later, the 3 things that we must know? Because from your topic, the 3 things that we must know regarding our health.
Absolutely. So,
Dr. Ajibade, just 1 second. Can anyone volunteer to tell us those 3 things just to see if, somebody caught it and still remember? The 3 things. There was a slide that addressed
cardio, immune, and brain.
Thank you. Yes. Did you hear that? Cardio, immune, and brain.
Yes. That's one of the. Oh, but actually
Thank you. I am so pleased with that. You can now expatiate, Dr. Ajibade.
That is fantastic. That's a great job. In fact,
Fantastic. Thank you.
We need to give them a prize for that, quite frankly. Yes.
So please, who is that again? Who was that? Mr. Adegbenga Onosonya.
Yes.
Thank you. I'm going to chat you. I'm going to probably chat you. Yeah, you're getting something for that. Go ahead.
Good job. That's my brother. Mr. Onosonya is my brother. My brother, Tikpe. Anyway, yes. So that was. Now, I actually, to be fair, I started with 3 things that we must know at the beginning, and I ended with 3 things that we must do at the end. So what Mr. Benga did was he emphasized were the 3 areas that we have to address as Black people, which is the brain, the cardiovascular system, because that's a big problem we have compared to whites, the immune system, and then I said more importantly probably is the gastrointestinal system, because 70 to 80% of the immune system is in the guts. And the gut is so important. So if we can't say we're taking care of the immune system, we're not taking care of our gut. So really more importantly, you want to address the guts, which includes the immune system. And then thirdly, we talked about the brain. That it's very important to take care of the brain and all that, but you can't talk about taking care of the brain. And I think this is an issue I have with the neurologist, Dr. O. So neurologists are always like, they're isolating that organ and they're just treating that organ. Meanwhile, all these other factors that address that organ may be even more important, like the gut and the immune system and the cardiovascular system. But they are just focused on that single organ. So very important. Now, at the beginning, I said 3 things that you have to know. Number one is that our bodies are different. We handle drugs and other toxins and other chemicals differently. Number 2 is that in general, we are deficient in certain nutrients that are vital for our body's functions, whether it's due to socioeconomic aspects, cultural aspects, or genetic aspects. In the case of vitamin D, we are deficient. We have to deal with that. Number 3 is that for many of these chronic diseases, we tend to have it earlier. We tend to have it more aggressively. It's more severe, and treatments don't work as well for us as they do. They don't seem to work as well for us as they do for white people. And the reasons for that are obvious. Most of the research and the treatments were done with the white man in mind, thinking that it applied to everybody else, but it does not. So,
Dr. Ajagbe, your question was answered. I'm going to go on to the next question in the group chat, if that's okay, sir.
No, thank you, Dr. Ajibade.
All right, sir.
Thank you. He did a fabulous job. So, Dr. Oduyebo asked, is the rate of metabolism uniquely responsible for drop in vitamin D levels in Black people? Yeah, go ahead.
No, it's more to do with genetics and the fact that we produce more more melanin. Melanin is like a natural sunblock. The way your body makes vitamin D, or the way everybody makes vitamin D, is by taking in sunlight, the ultraviolet B rays of the sunlight, and then I don't know what it is. Well, there are chemicals in our skin that use the sunlight to make vitamin D3 in our skin. If there's clothing, if there's any barrier to that, and the barrier starts with melanin, can act as a barrier to us getting enough vitamin D. Or if there's clothing, or if you're in the sun, if you're in the house, even if you're in the car and the windows are up, you are not getting it. Even during the winter and the sun is shining, because of the angle of the tilt of the earth, you may not even be getting you may not be getting the specific ultraviolet B rays that your body needs to make vitamin D. So again, it's primarily due to our genetics, but our genetics, on top of that, our lifestyles, our being indoors all the time and not taking advantage of the sun. Dr. O, have you realized that the poorest countries, even the poorest countries in the world, have access to, are the ones that have the most sunlight? In other words, God, our maker, he wanted to make sure that this all-important vitamin, with no country in the world will lack it, especially the poorest countries. So vitamin D, that's just to answer your question, sir, is mainly because of the melanin. Some people say for a white person to make vitamin D in 15 minutes, they say that sometimes 6 to 10 times that amount of time it will take for a Black person to make that same amount of vitamin D that the white person does, depending on the degree of tanning or the degree of melanin that the person has, the degree of pigmentation that person has. So it's a big problem, especially during the winter. And as a matter of fact, what happens is that during the winter, white people will get to soak in their vitamin D and they can keep it in their fat, as Dr. O says, it's a fat-soluble vitamin. So they soak up enough to last them through the 3 months. But meanwhile, we don't soak up enough. So if you are totally oblivious of this, the white person who is totally oblivious, has no idea what we're talking about, they are okay. They'll during the summer and during the autumn, they soak up enough vitamin D and they store it. We will not. So once winter comes, boom, the body uses what is remaining, or with the little that we're able to make, and we're in severe deficient states. I don't know if you've noticed that during the Dr. O, during when you test during the winter.
No, I have not noticed that. My patients take their vitamin Ds. They listen to me a lot, so they're consistent. But what I would say though is that the melanin we have is actually protective, so we don't get as much skin cancers like our Caucasian counterparts. So everything is give and take. God knows what he's doing. And so I tend to want to focus on, okay, so what do we need to do? Take your vitamin D. Because, yes. And I don't believe we are poor countries like in Africa. We have lots of resources. I just pray that we would have good leaders and, who can make sure that we tap into the resources we have and, be greater nations. But we are very rich in African countries, and thank God for the sun. But we do have the melanin that shields us from it, like you said. And thank you for expatiating and explaining that. So, Mr. Chris Otaigbe, go ahead.
Thank you very much. Thank you so much, Dr. Ajibade. I mean, I'm learning a lot. Maybe at the end of this medical Monday, I'll become a doctor myself.
We give you honorary.
Yeah, so, what I want to ask now is a bit away from what we're talking about, but I still think it's connected since we are talking about blacks and whites and, how both their body mechanism react to the medicine and what have you. During the COVID-19, a lot of people were dying. In fact, it got to a point as a journalist, some of us were naming COVID-19 rich man disease, because it was the rich men that were dying and all that. And we're told that, social distancing and all of those things. And then at the end of the day, during the COVID lockdown, something scary happened. In Nigeria, Dr. Ajibade will bear me witness, even though there was lockdown, the markets were opened. So as someone was scared that a market like Oshodi, a market, all those highly densely populated places, people were going to die, maybe like Bill Gates' wife said, but going to start dying like flies on the road. And at the end of the day, we covered it very well. I didn't hear anybody die in Oshodi or dying on the road and all of that. But rather we're hearing bigger guys, top rich men dying and all of that. We're talking ventilators and what have you. But the point here is that, yes, that didn't happen. And I was wondering, what is the medical reason for that? I thank God that came to me right now. Maybe today I'll be able to get an answer to that. What happened? Why didn't that happen?
Okay. Dr. Ajibade, I'm going to start that real quickly before going to this. It did happen. And it was not a rich man's death disease, like people said. It was the rich men that were publicized. The rich men had the clout. So when a rich man is ill, it gets into the newspapers. When a rich man dies, it gets into the newspapers. News was made. A lot of poor people, a lot of them died. A lot had COVID that was not diagnosed. They couldn't even afford to test for COVID. It was too expensive, and they didn't have access. I came to Nigeria back and forth. I knew exactly what was going on. Immediately, look, March 2020, I left Nigeria with the last British airplane that was allowed to fly out. I changed my flight to get out of Nigeria to come back here when they were before the lockdown. And I treated lots of people across. Because there was a state of emergency, it was allowed. Now, when the borders opened in October, the second plane that left here, October 19, I took it, they returned us back to New York, Delta. It was the day NSAS happened, and we were not allowed to land in Senegal. I went back December 19th. So I wanted to tell you that I stayed current with what was going on in Nigeria, as well as what was going on here and what was going on in the UAE. And I can tell you, lots of people died. Lots were not, they said they have severe malaria. They had COVID. They could not pay for the test. If you don't test, you don't know what you have. If they don't have severe malaria, they will say they have, if they don't say severe malaria, they will say it's typhoid, severe typhoid. It was during COVID that term, severe malaria, was coined. That's not a medical term. Malaria is malaria. It was COVID. So people died. Our population is a lot. COVID did not make much dent, yes, because we are a lot. There was somebody in Surulere, a young boy in his late 20s or early 30s who died. His death certificate said COVID-19. His family said he had severe asthma. You met Rafiu. Rafi was the one who got the death certificate and said, excuse me, it's COVID. It's not severe asthma. So what you read in the news is because it's the rich man that, or the rich people that make it to the news. We thank God that it was not worse than it was.
Well, you thank God now.
Yeah. Thank God. So in the chat box, there are comments. Tony Ajayi commented on the fact that vitamin D is very good and what the levels are 30 to 100. Temi said our forefathers, regarding our forefathers, ate good foods too, no chemicals, no microwaves, etc., which is true. We addressed that. Yoruba Nurses Not America said, it's very true that our emotional response to disease determines disease progression or disease prognosis, and she's right on the money. Paul Otaigbe, sorry, I got to get your name right. Paul Otaigbe said, asked what BMI is. BMI is, it's called body mass index, but it's actually the weight compared to the height. So they looked at people that are, say, 5 feet, 5'1", 5'2", and up like that, and the children going down the other way. And then they compared their weights. So they decided what is normal weight compared to height and what is not. So when somebody's body mass index is between 19 and 24, that is normal. But when it's over 24, then they are overweight. When it's 30 and above, they are obese. And when they get to 40 and above, they are morbidly obese. When they are less than 19, they are underweight. So that's basically what he is. He's comparing the height with the weight. Did that help?
Yes, it did. Yes, it did. Thank you very much. Now I can intimidate some of my laymen that I know this things.
Fantastic. Fantastic. So Sister Lola Romanaron said, thank you so much, Dr. Adewale, for your contribution. And I hope Dr. Adewale is still on. Is from Nigeria. Temi said, Dr. Ajibade, do you ship the supplements to the US? If yes, what's your website to order? I hope you have your website on the platform already, Dr. Ajibade. You are muted.
Yes, sorry. Yes, I put the website on the platform, but it's
can you copy and repaste again, please?
Yes, ma'am. I'll do that. But it's always better. I don't want it to be self-serving, but it's better you talk to me first before you just order anything. So I would recommend that you just.
Can you put your contact information on there too, please?
Okay. Yeah, sure.
Okay. Thank you. So Benjamin Olorunfemi said, good morning from Nigeria. Good morning, and thank you for joining. He said, Doctor, I have a case managed by my organization. I run an NGO on NCDs related here in Nigeria on a member that had a partial stroke sometime last year. He couldn't manage his blood pressure very well, and I advised that he just has to work hard on his blood pressure. To cut the story short, as we speak, the person is displaying some symptoms of dementia. So, Dr. Ajibade, what's your take?
I don't know what you're. No, sorry. I'm sorry. I laughed. I don't know what the question is, Doctor.
The person, he runs an NGO. He knows somebody who had a stroke because they were not managing their blood pressure well. It seems like the person still isn't managing the blood pressure well. But he said his question is, the person is displaying some symptoms of dementia. So what to do to intervene, I guess, is the question.
Yeah, so
My guess.
Maybe having a kind of dementia known as vascular dementia, which is related to strokes. What we do in Nigeria and what we do for people around the world that have strokes and dementia is that we schedule appointments, and then we explain what we do and how we do it, and we arrange. Once they make the payment, we arrange for them to get the supplements, and there's a 3 to 6 month process of me working with the person or the caregiver and telling them what to use and how to use it, and waiting for feedback and responding to the feedback. So it's not just a cookie cutter approach where you just say, take this pill and take that pill and then forget about it. It's a continuous process. So it's not a question I can just answer directly. We have to work with the caregiver who is directly taking care of the individual who has the condition. Dr. I think you're on mute.
Sorry, I didn't realize. So your contact information is in the chat box, correct? So
yes, I put my WhatsApp number in there.
Okay, yeah. Please do that. So regarding the back pain, I'm very glad that Sister Aromolaro wrote there also that there are certain exercises targeted for back and they work. And, you know, she suggested Googling these exercises as I did. And she said that you are right, Dr. Ajibade. There are targeted exercises. So Dr. Nwabweze said recently, many patients present to the clinic complaining of bilateral lower limbs edema, that is lower leg pain, that is both of their legs. They complain of leg swelling. And these people are on calcium channel blocker. Does anybody else encounter this in their clinic? Yes, one of the major side effects of calcium channel blockers, especially amlodipine, is leg swelling. And for somebody who has it, we stop the medication, the swelling resolves. I mean, we put them on another medication and they do well. It resolves, there's no sequela. So
do they have joint, do people on amlodipine have joint pains?
No.
Knee pains?
No.
That's not.
No, it's just that leg swelling. It's one of these possible side effects for people who are going to get it. They have the lower leg swelling and we stop it and it resolves.
Okay.
Of course, when your leg swells, it may hurt, but you know, it's leg swelling. That is the major thing. That could be a potential side effect. So Lola said bitter leaf capsules can also help to lower your cholesterol levels. I've heard that. Sister Romolaro said, do we have any good food for protecting organs from getting damaged? Food, any good food? Dr. Ajibade, any good food that helps protecting organs from getting damaged?
Yeah, in a general way, it's some of the things that we talked about here. But most importantly, I would say the omega-3s. So that's the fish thing.
Well, Damien from Dublin said oatmeal is greatly recommended daily as part of cholesterol regimen or combating cholesterol, including omega-3. And he wanted to know, how does oatmeal work? It's from London. And, you know, that's the regimen they give them, oatmeal with omega-3. How does oatmeal work?
So my personal opinion, and this could be this may be taken either way, is that oatmeal is a grain. I have a problem with oatmeal because it's a grain. It may contain fiber, but most of the oatmeal that is made, as commercially made, they are made with this modern day farming, and we all know that many of these cereals and oatmeals and all these things have the herbicides and the pesticides as part of their, unless it's specifically called organic. My experience is that they can raise, even oatmeal can raise blood sugar levels, and they may not help with blood sugar levels much. So I'm comfortable with omega-3s, not comfortable with oatmeals. That's just my my experience.
Thank you. So with regards to the ICD-10, Dr. Augustine Nwabweze said, usually most police violent deaths end with suffocation. So most of them will get coded as that, shortness of breath, that they died from shortness of breath. So that's is right. You know, it's stuff like that that we come up with. Okay. Lola said to Chris's question about COVID that some poor people died on the streets in Nigeria, and it does happen. Honestly, a lot of them died during COVID. Thank you so much, Dr. Ajibade. I see your WhatsApp number. I see your website. I love it. Thank you for sharing that.
Sure.
Thank you. So, any other questions? This has been fabulous. For a last minute, Dr. Ajibade, thank you so much.
My pleasure.
So what would you recommend for breakfast? I usually take oatmeal, so is oatmeal not okay?
Me too.
Yeah, I know. So what I would recommend, I don't generally eat breakfast, but I would recommend eggs. I mean, they've come full circle now. Eggs are very, very good and very, very important and very healthy.
Yay. So eggs.
Yes.
You know that it takes 2 weeks from eggs to chicken. What about all those hormones and everything in eggs?
Well, I mean, yeah, sure. There's you want to get the organic ones. That's better for sure. But the eggs as a whole are the healthiest, also the healthiest and most complete foods you can get. So proteins. Now they say you should focus more on proteins in the morning, because that helps regulate your blood sugar, and a lot of it has to do with blood sugar levels. I mean, people are now saying all this. So oatmeals can spike your insulin levels and spike your blood sugar levels. So what you want is something that does not do that. And so proteins and probably even healthy fats in the morning can be helpful. Other than oatmeal, cereals. So I mean, everybody takes cereals and oatmeal. So it's very hard to find something else. Even breads, you want to reduce your bread. You really want to minimize or even eliminate bread from your diet as much as possible. Minimize it. So, so sweet potato. Now, the problem with the US is that the sweet potato is terrible. Nothing like what we have in Nigeria. I mean, I've tried and bought for gone everywhere to buy goods. I can't find any good sweet potato. But sweet potato is generally recognized as a healthier substitute, even though it's carbohydrate, but it has a lot of fiber. It has a lot of vitamin C. It has a lot of nutrients. It's one of the healthiest things I have ever eaten. So if you can get a good source of sweet potato, that would be great. So eggs, meat in the morning. What else?
No eggs.
No eggs.
Why do you say that? What about steel cut oats?
I don't know what that is.
Steel cut oats. They are organic oats. They don't have chemical. That's what people say. They're better than your regular oats meals, that the regular one that you're used to. You should Google it.
Yeah. So steel cut. So if that's so, without the pesticide and without all the extra stuff in it, then yes, that would be a better option.
How many eggs a day?
No eggs. You don't mind.
Why do you say that? You've not seen the latest research on eggs.
Maybe the ones from those chickens that run around in front of our house in Nigeria. Those ones. But the ones that are loaded with chemicals, no, I think we should stay away from them. And then Sister Lola said you can get good sweet potatoes and more varieties from Asian stores.
Asian stores. Okay. Thank you, Ma. Thank you for letting us know that. So the three whites: white rice, white bread,
white
flour. You said what, Dr. O?
I'm kidding.
So the three whites, you want to stay away from white bread.
White Gary. At Tower.
So let me ask you a question, please. What about eating for your blood type? Is that okay?
Some people swear by it.
I can swear by it also.
Okay. So the thing they say, if you have A group, you should not eat much meat. And if you're O, you should eat something. So yeah, I know a little bit about it, but I just don't know too many people who can actually stick to such a rigid routine. But those who do, they have great results. They have more energy, better sleep, and so on and so forth. What are your results?
Very good. And I eat according to my blood type. I've been able to keep my weight since I started doing that.
Did you lose weight? What do you mean by keep your weight?
I'm not big anyway. So I'm very, very healthy. I'm not in any medication. I exercise every day, and I eat very well.
Okay. I wish you would be more specific about the results you got from that, though.
But I know it works. I don't. Yeah, it's good.
Okay.
So somebody just put up just 1 minute, man. Somebody put up the steel cut oats. Can you put it back? Yeah, Dr. Ajay. That's the steel cut oats. That's what it looks like. It doesn't look anything like the one you're talking about. And I think we ought to research this more and maybe, share more about it. But this is recommended to be much healthier.
Yes, and is it available in everywhere?
Yeah, it's available. I know that I think Costco has it. I think it's widely available. Just steel cut oats. Thank you, Dr. Ajay.
What about red beans, honey beans from Africa? Is that okay?
It's excellent.
Oh, good.
Yeah, yes, that's another thing. Beans are really
protein. Good. Those are good.
Yeah.
So the honey beans, not the black eyed beans. The honey beans.
They are good. Okay. They're better than the black eyes, in my opinion. Okay. They're sweeter.
Dr. O, I have a question in the chat box.
Yeah, I'll get to it. Auntie Tawa has a question, and she takes priority because she wants to ask it personally. So go ahead, Auntie Tawa.
Good evening, everyone.
Good evening.
So, Dr. Ajibade, can you expand on that blood type related to food? I've never heard of it.
So I just know it in a general form. So you have the four blood types: the O, the B, the AB, and the was it that one again? O,
AB,
and AB. So what people have researched in is that certain blood groups do well on certain kinds of foods. So I think I'm A. So I'm not supposed to eat much meat. I guess that's why I didn't like the blood group. I didn't like that thing because I'm a meat lover. So as far as I'm concerned, that's all foul. So, but some people tend to like Rosemary. And I know other people too who have who have adhered to that rule. And so they found out they read the book, all group people should eat this, they should avoid this, and they stuck by it and they got good results from it.
Wow.
For example.
So for blood group A, you said meat and what shouldn't you eat?
I can't remember. Like I said, to me, I threw the book away as soon as I got to that.
A group has to eat a lot of vegetables.
Okay.
Yes, they have to do all vegetables all the time. So, stay away from that meat, please.
That won't work for a Nigerian. We grew up being deprived of meat growing up, and then you now come to the US and there's meat everywhere, and you now say, well, no, you can't eat it. No way. Not gonna happen.
Thank you.
Okay, so that's quick cooking steel cut oats. So you can get this. Where is this?
Trader Joe's. You can get it from Trader Joe's.
This is from Costco. Trader Joe's too, Sister Rosemary says.
Yeah.
Thank you so much for sharing that. So there's a question in the chat box from Folusho Ola. And the question is directed to me. She said, can you please tell us again what you eat to keep your weight off? What about...
Yours is genetic and yours is genetic, Joe. You have hyper-metabolism, Dr. O.
Eat according to your blood type. You will lose weight.
Don't deceive anybody, Dr. O. Your own is just natural.
Okay, so Folusho Ola, Sister Folusho Ola, you've heard Dr. Ajibade is right on the money. And, this one I'm not going to argue with him because I just have mad high metabolism. It doesn't matter what I eat, I burn it. I actually struggle to put on weight. I've been on this forum asking for suggestions what I need to eat to put on weight because I did something, and I'm going to share that with you because it does work. So I've never had weight issue, but on Medical Mondays, Dr. Sandu presented plant-based diet and offered to give free classes to some of our Medical Mondays family. So we started the forum and she insisted that I participate to assist along. So I did. And in participation, I was very faithful. Plant-based diet helps you to prevent disease entities. And mention it does. It's research proven. But the side effect, the adverse effect of plant-based diet is weight loss. So what is plant-based diet? You don't need anything that has life, animal life. That includes eggs, meat, chicken, fish, lamb, shrimp, name it, lobster, all of those. They have meat life. You don't eat anything like that. You eat only plant-based food. And I did and started shedding weight like crazy. I mean, I was dropping weight. I got scared. I came to the, Auntie Tawa was part of the group. There are some other people here, Dr. Veronica. I went on the platform weekly complaining that, wait a minute, I'm losing weight. This is crazy. I don't have any to lose. And I didn't want to get out of the program, and I was very faithful to it. She told me to start eating peanuts. Peanuts did not work for me, did not put 1 pound on me. I ate peanuts already, and so plant-based diet, if you're looking to lose weight, I think it's a healthy way to do it. It's a lifestyle change. Don't go on any fad diet. And intermittent fasting, you want to couple that with intermittent fasting in that you eat, cut off your eating at like 6, 7 latest, and then make sure you fast for at least 15 hours before you eat again. One of our speakers helped us understand on Medical Mondays that breakfast is really breaking your fast. So if you cut off eating at 6 in the evening, you start eating the next day between like 9 and 10. So you have fasted 15, 16 hours. And you eat small meals through the day. You eat whatever, but healthy eating. cut off the carbs, like Dr. Ajibade suggested. It's more fiber. And up here in the chat box, I want to see Tony Ajayi suggested eat more vegetables, and fruits, cut down on carbs. That is true. That helps to keep the weight down. And then at 6, and if it's 7, you decide to cut it off, you cut off eating. If you cut it off at 7, then you start eating again like 10, 11 o'clock, even 12, in the morning. That's what Dr. Ajibade is doing. He was big. He was actually totally obese, even with the body, with the large bone mass. He's no more. So it's now great. But he's doing intermittent fasting. Did you hear what he said? He said, I don't eat breakfast. Yes, he's doing intermittent fasting because it's when he starts eating that is later in the day is why. Sister Lola suggested, good sweet potatoes. And did I answer your question? Did I answer your question? I prayed.
Yes, ma'am.
Thank you.
Yes, ma'am.
Thank you. Please reach out to me if you have any more on that. But trust me, if you're looking to lose weight, do it that way. It's a lifestyle change. You will get good results, and not just for the weight. Your core health would improve so much, it will blow your mind. Energy would improve, and weight loss would just be a side effect, which is how you want it to be. And you don't want to shed 10 pounds, 30 pounds in a week, in a month. You don't want to do that. You want to take off like 1 pound a day. 1 pound a week, which will amount to 4 or 5 pounds a month. No more than that. With lifestyle changes, that's what you take off, but you will maintain it. And you'll start glowing. People will be asking you, what are you doing? And you can then help them out. Okay? Reach out if you have more questions. Yes, go ahead.
So I just want to quickly just mention this. I did lose weight, but I also increased my level of activity too. And I think that's something that we probably have to emphasize more and more to our Black community. We're just not moving enough. That's what I see. We're just, when we get to be a certain age, we just don't move much. Fortunately, I learned how to play squash very well. So I stayed downtown Baltimore. So people always wanted to play with me, the whites as well as the Igbos. So they always getting me called. So there was one surgeon that would call me in the morning, like 6 o'clock, that we should go and play squash. And against my better judgment, I will still go and play with him in the morning. Sometimes I'll play again in the evening and all that. So obviously most people can't do that. But just to get out, in the summertime, please get out in the sun, move around a lot, as much as you possibly can. If you can do that, that will be helpful as well. I know that intermittent fasting alone didn't do it for me. I would be deceived. I would not be totally honest with everybody if I did not interject and say that there were other things involved as well. So, and I also use supplements too that help to address my hormones. So that's the other things that I did as well that helped.
So I talked about plant-based diet, intermittent fasting, and yes, thank you very much. Exercise is very important to move around. Yeah. And, before I take Sister Rosemary, Dr. V asked about free-range organic eggs, and I think those are better. Egg whites, if they're those powdery ones, please don't do it. It's not, I don't know what they are, So, Sister Rosemary, go ahead.
Yeah, I want to suggest something for her. Google eating for your blood type, but know your blood type chart, and then follow through. They have beneficial food allowed and avoid. You probably avoid the food that is not good for your blood. That's the reason why you have difficulty in losing weight. When you do that, and please cook your own food. Don't eat outside. Cook your own food. Know what you're putting into your system. It helps also. And exercise. Work out every day. Take time, if you don't take time to exercise, you're not going to get the benefit. And then intermittent fasting, like Dr. O said, helps a lot also. Good luck.
Thank you.
You're welcome.
Thank you. So, without much ado, we have been here for a while. Believe it or not, time flies when you're having fun. It's almost 10 o'clock. So it's been an amazing Monday, and I think we've learned a lot. Thank you so much. And we'll see you again next week for another, powerful session. And before we go, I just want to share a Medical Mondays moment that yesterday I was so down. I was shocked because I don't ever catch myself in that state. But I woke up in the morning and I wanted to call my mom to wish her Happy Mother's Day, and realized, wait a minute, Mommy is no more here.
Oh.
And it's the first Mother's Day that I've been without my mother. And I was shocked at how it was just, it was an interesting feeling, that I don't have Mommy to call to wish happy birthday. So I just wanted to share that with my Medical Mondays family.
Another
End of life. Thank you.
Dr. O, we love